My name is Janice Smiley, and I'm the director of the Alabama Department of Public Health State Perinatal Program and the text4baby State Coordinator. I bring you greetings from Dr. Williamson, the State Health Officer, who announced last week the 2011 infant mortality rate, which was the lowest ever recorded rate for infant mortality in the state of Alabama of 8.1. However, according to Dr. Williamson, we still have a lot of work to do. September is Infant Mortality Awareness Month, and we're here to raise awareness of how we can do, what we can do to work together as a community to address infant mortality. The Alabama Department of Public Health has been supportive of text4baby since its inception. And over the last 2 years, we've worked with partners around the state to spread the word about the program to pregnant women and new moms. We're excited about today, and we're excited about the work that has been done with partners. So at this time, I have the pleasure of introducing Mrs. Susan Kane, Director of Corporate Equity for Johnson & Johnson, who will share more information regarding text4baby.
Thank you so much. Alrighty, when I'm short on stature, I'll hopefully make up for with enthusiasm for sure, because I am just genuinely thrilled to be here. We love the text4baby program. I get the honor of sharing with you exactly what that is, but to be talking about it, you know, out in the community where people are coming together to actually make a difference in infant mortality and prematurity, that's the fun. That's the fun of this job. And, you know, it is Infant Mortality Awareness Month, and as I write it on my calendar and I think about, okay, so it's the month of September, what are we going to do? How are we going to raise the profile and the importance of this issue? Because the United States has one of the worst rates in the world, I have to tell you, of any developed nation, and that's just not okay. 28,000 infants die before their first birthday in the U.S. And as I was thinking about these numbers, I said maybe they need to rename this month to Infant Survival, right? Infant Survival Month, because that's what we're here about. And so text4baby, you know, it's not the total solution, but I think it's a piece of it. So why is Johnson & Johnson involved? I guess I'll start there. For, you know, over 125 years, our entire history as a company, we've dedicated ourselves to philanthropy, and the core of that has always been around mothers and babies. And so when the opportunity, you know, came up for us to get involved with text4baby, when it was on the drawing board, it made a ton of sense to us, and it made a lot of sense for two reasons. One is there's a lot of moms out there, expectant and new moms, that could use the support, and think of all of the ways that you can touch people. And then we thought about, gosh, mobile phones, that's a really brilliant idea. Most people, precisely 89% of women in the U.S. have a mobile phone. You could reach a lot of people with SMS, so let's give it a try. We could really extend, you know, our reach of support. So that's the history. I think the really important thing with text4baby, and I look around this room, and why we're here, is partnership. You know, it's a terrific program that was really developed by Healthy Mothers, Healthy Babies Coalition, which is a not-for-profit organization that runs it in close support with Voxiva, which is the technology arm that really came up with the idea, the brainchild, I will say, of them, as well as someone I'm going to have the pleasure to introduce in a few minutes, but the wireless carriers. So next time you get your wireless bill, this is what I tell all my colleagues, just remember that those providers are providing these SMSs for free. So it does not go against a woman's data plan. It does not, you know, if they don't have a data plan, that's fine. So we all came together to launch this program, and so that's the beginning of a partnership, but it's only the beginning. It's, you know, we think about partnership at J&J, especially in our philanthropy arm. We don't do anything that is not in partnership, and it's always with that local community level, because that's who knows the community best, that's who's on the ground, and you really cannot make a lasting, enduring difference if you don't partner that way. So for us, text4baby was a way to look at partnership really broadly. So yes, of course that. We've also got, you know, the White House. You know, our current administration has been beyond supportive of text4baby, And that's brought us, very close with the CDC, with HHS and other agencies. We have the national program, so, your pediatrician, the group, the professional society they belong to, the professional society your obstetrician belongs to, they are all supportive of this program and help build the content for it. So all these partners have been really important, and then we get to our local and state partners, and that's who's really getting the information into the hands of expectant and new moms. And that's the most critical component of the entire partnership in my mind. And a couple of people I met earlier said, why Alabama? You could go to, 50 states and talk about text4baby. And number one, I'm thrilled to hear that your infant mortality rate has decreased. Obviously, anything above 0 is not okay, but congratulations. So yeah, Alabama's up there, but you also have one of the most active partnerships that we have, and that's why we're here. So I cannot commend and thank everyone here for your partnership, because it's really what's brought it together and made it work. So how do you sign up for text4baby, and what exactly happens? And with that, what do you do? And you can do it right now if you want, or you can do it when you go home. You just take your cell phone and you text the word baby to 511411, or if you prefer Spanish, we also have it in Spanish, you can text the word baby for Espanol. And you'll get asked a couple questions, and they're really simple. When is your baby due? Or if your baby was already born, when was the baby born? And then the other thing we want to know is your zip code. And here's why we need those pieces of information. This is stage-based information based on that due date that you text in. You'll get 3 free SMS messages, 3 text messages a week into your phone with information of what's going on exactly that week. That way you know what to talk to your doctor about. Or if you're looking for a resource, I'm not sure where to get a flu vaccine, or is it safe for me, or how would I sign up for WIC, or all of those things are made available through these messages, so you get the right information at the right time. So it's something that's very unique about text4baby, as well as it's the information you need just at the time you need it. And then the second piece of information, zip code, has become increasingly important. As text4baby has grown, we now have about 420,000 women enrolled in the program. What some state governments have seen, and certainly the CDC has seen, is wow, this is a great channel to get really time-sensitive alerts out to moms. So what do I mean by that? A couple examples. When there was a change in car seat regulation, right, to no more front-facing, rear-facing, we sent out an alert at the request of the CDC to all the enrolled moms. In the state where I work, in New Jersey, we are one of 9 states that is in the throes of a very significant whooping cough outbreak. So what the CDC said is, could you push out a message just to these 9 states? Since we had those zip codes, we could get to the right people. If something's going on very locally, we can also use that zip code to connect people to resources close to home. That's important. So that's enough, I think, about text4baby, but that's how it works. That's how you sign up for it. With that, I think I'm going to just close, before I turn it over to Kimberly, to begin to answer what was the biggest question I had on my mind as we embarked in this relationship with text4baby is, feels good. Feels like the right thing for Johnson & Johnson, baby company to do, and it's great to send this information, but is it going to work? I'm a nurse originally, so I fully disclosed that. So as a former pediatric nurse, I said, this is great. Is it going to work? We can feel good, but it's got to work. And the very great news is it really is working. We have our first couple rounds of outcome studies in, and we have huge numbers of people changing behavior and doing things because of messages they've received. So we're very excited about the future of text4baby, as well as just this mobile health and what we can use, maybe apply to other disease, 2 disease states and so on. So that's text4baby. Again, I'm thrilled to be here. Thank you all for caring and for being here. And now I get to turn the mic over to my friend and colleague, Kimberly Bassett from the Wireless Foundation. Great.
Thank you, Susan, and many thanks to all of our Alabama partners. I'm very pleased to be here with you today. I'd also like to thank Mayor Evans and Congresswoman Terry Sewell. I work for an organization, CTIA, and we represent all the wireless carriers and manufacturers, and we advocate for them on the Hill. And I see Congresswoman Sewell everywhere, and she is running. She is working for you all. I can guarantee you that. But it's so great to be in Selma. I woke up next to the Alabama River today. It was just fabulous. And I met a lot of you today, and I'm glad that you're signing up for text4baby, right? 511-411. This is providing such a big help to hundreds of thousands of new expectant mothers. And one of the unique aspects of text4baby is that it uses widely adopted technology like text messages to address a really unfortunate health problem. What's interesting is 80% of women in the U.S. have a cell phone, and I know y'all are talking on it, and 72% of the adults with cell phones send and receive text messages, so I know you're texting. We see this opportunity by using this technology and working with a vast network of partners, as Susan mentioned, like National Healthy Mothers, Healthy Babies, and Johnson & Johnson. We are disseminating this information. And text4baby combines the power of wireless communications and innovative public-private partnerships, and we just try to give babies a healthy start. And I'm extremely proud of the wireless industry for stepping up as a founding partner of this initiative. I know that everyone always thinks, oh, they're charging us so much money for our texts and our calls, but a lot of really great, wonderful things are coming out of these companies, and this is one that we're extremely, extremely proud of. And a lot of we play an important role by offering these helpful text messages at no charge, and we really hope that we can change behaviors of mothers. 3 times a week, mothers and mothers-to-be are receiving texts with this essential health information, and they're learning things such as early prenatal care. They're learning about immunization, safe sleep, prevention of birth defects, avoiding substance abuse, injury prevention, and other critical healthy safety issues. CTIA and the wireless industry applaud the leadership of partners in Alabama. You guys are doing a wonderful job. I mean, we go all over the country. I'm going to Fort Worth, Texas next week, tomorrow, and you guys are doing so much. So thank you, Alabama, and thank you for doing all your work, and your continued commitment is crucial to getting our nation's baby off to a healthy start, and this success of text4baby. And we extremely support you promoting text4baby, so tell all your friends about it. It'll help provide pregnant women and new moms with critical information they need to care for their health and just have their babies have the best possible start in life. And thanks for what you're doing, and thank you for including the wireless industry in today's event. And next, we're joined by Mr. Jackie Holliday, Administrator in Alabama Public Health Area 7. Come on over. Thank you so much. God bless you.
I think the last time someone gave me a microphone, I probably stood for maybe more than an hour. I can assure you I won't do that today. Good morning.
Good morning.
Let me say thank you for the opportunity to be here today and represent the Alabama Department of Public Health. Each one of our speakers this morning has demonstrated a tremendous amount of energy. They're all very energetic and excited about this opportunity. The Alabama Department of Public Health is very, very excited to be a partner in this opportunity today, and we look forward to the growth of this in the state of Alabama. This is a wonderful service, and we're very, very tickled to be a partner with that. Kim, thank you for all that you're doing in the wireless industry to promote this. This is critical and very key to the success of this program. I want to recognize a few members of Public Health Area 7, which is the 8 counties in west central Alabama that we represent. Dallas is one of those. A couple of ladies down at the end of the table over here did a lot of work in preparing for today's conference and discussion. Denise Pope, stand if you would today. Denise is our nutrition director in Class 37, and you'll be, I know, amazed at her cooking skills just a little bit later on when she does a little cooking demonstration on some healthy preparation. Sitting next to her is Brenda Anthony, and she is our Area 7 nursing director. And both of these ladies did a lot of work in coordinating with Louisa and others to make today possible. Over here to my left is Diane Abernathy, and she's our All Kids representative over here, and she's going to be making a presentation about tobacco cessation. I want to thank a number of organizations, including the Alabama Department of Public Health, and today moms will learn a number of tools and resources available to them, like text4baby, as well as connected directly to important health resources and services. If you have a chance today, stick around and share a few moments of your time with moms who are here today. Learn more from their experiences and see how we can all work together to equip them with the tools and knowledge to help keep them and their babies healthy. You should also take a moment to walk around the room and check out the different resource tables that we have here today. And thanks to our many partners in the room. Today is just the beginning, as I said earlier, and there's more that we all can do, which is why we intend to work with our partners around the state, not only Public Health Area 7 and not only Dallas County, but around the state, so that we can connect families to these important services. By working together, partnerships, we will be able to reach more women and families in the state of Alabama with critical information about access to health coverage and health care. It's my pleasure now to introduce a text4baby user, Chantel, who will share with us some information about her experiences in utilizing text4baby.
Thank you, Mr. Holliday. My name is Louisa, and I work with text4baby. We're going to change the format just a little bit. We're going to do sort of an informal interview. So Chantel will be very confident speaking to the group about this. So can you tell us a little bit about yourself, Chantel?
I'm 19, and I'm pregnant with my first child, and I'm now 13 weeks. And, you know, my social worker, she introduced me to text4baby, informed me on insurance for myself and my baby, and helpful information about, stuff that I didn't know about, that I was supposed to know about my baby, needed my baby.
Perfect. So we're both expecting. I'm 18 weeks. She's 13. We're both using the service. I use it in Spanish. She uses it in English. So can you tell me, how did you sign up? We have a couple of ways we have to sign up. Most people sign up via text messages. A lot of people sign up via their computer. So how did you sign up?
I signed up through text message.
Was it easy for you?
Yes, ma'am.
How long did it take you?
Maybe 2 minutes.
So what Susan mentioned earlier in terms of just asking for your due date and your zip code, that's all we asked, right? We didn't ask for your income, we didn't ask for your race, we didn't ask anything beyond that, correct?
No, ma'am.
So we have living testimony. Perfect. Can you tell me what is one of the text messages that you remember you've received so far?
Yesterday I was wondering about, do I get a flu shot? And I asked my mom, I was like, Mom, what do I do? Do I get a flu shot? And yesterday I received a text, pregnant mothers need to receive flu shots, and we can get very sick, and the baby can, get sick, because our immune systems aren't, as strong now.
Perfect. See? So you're learning a lot, and that's what we want. Thank you very much, Chantel. It's a pleasure to have you here today and for you to share your story with us, and we wish you the best with your pregnancy. May it be a healthy, beautiful baby.
Thank you.
Thank you, Chantel, so much for sharing your story. We know that there are many other stories out there just like that. At this time, I wanted to thank the representative that has joined us today. This is truly a great day. We want to thank Ms. Susan Kane from Johnson & Johnson. Ms. Kimberly Bassett from CTIA, the Wireless Foundation, and Mr. Jackie Holliday from Public Health Area 7. We greatly appreciate your support in making this event a reality and your ongoing work to make a difference in the lives of moms, babies, and families. I am pleased to introduce the Honorable Mayor George Evans. I have known Mayor Evans since I was a little girl.
So have I.
He was the principal of the school that I attended as a little girl. And I was just thinking this morning, okay, I turned 50 this year. How old does that make him? So, at this time, I introduce the Honorable Mayor George Evans.
Well, good afternoon, everybody.
Good afternoon.
That makes me 51. I do remember her family, all of them. We went to Tipton High School years ago when I used to teach, coach, and was principal at the high school there years ago. And I was proud to see her today. I hadn't seen her in many, many years. And she hasn't changed a bit. She's spread just a little. But not a lot. And I had to tell that because she told some things that I had to sort of get her back. But nevertheless, I'm happy and honored to stand before you today and be a part of this event that's taking place here, and to welcome all of you to Selma and to the Alabama Farmers Co-op, and to thank you for joining us today to commemorate the National Infant Mortality Awareness Month that is so critical to all of us here today and others who are not even present. I want to thank some more agencies that also been a part of this. I want to make sure I don't leave any of you out, so I want to mention the Alabama Department of Public Health Area 7, the Farmers Co-op, Dallas County Health Department, Linden Health Department, all of who are here today to be a part of this program to make a difference here in Selma, Dallas County, as well as in this nation. I'm pleased also to welcome all of you here to Selma, which is the Queen City of the Black Belt. Actually, Selma is the third oldest city in the state of Alabama, third oldest city. And plus, Selma has more history here in Selma than any other city in the state of Alabama, contiguous history in Selma than any other city in the state of Alabama as well. So welcome to Selma and to being a part of this program here today. And as you know, we are here to commemorate this National Day for awareness for the mortality rate of our young people. We're also here to indicate also that our state is ranked third in the country in terms of this mortality epidemic, or as you say, it could be this problem that exists with infant mortality. I'd like to also mention to you today that we can do a lot in making a difference by everyone here, one baby at a time, as well as by one family at a time in making a difference. And they say that our families, our children should not become statistics. As a result of our work here today, that number should reduce itself. It's already been said earlier that we've already seen a decline in the number of mortalities of this case. The text4baby, I never heard of that before until I got this information. Text4baby, I've heard a lot about texting. And I think that some people rather text than talk. And I think in a meeting of this type, you can always see someone addressing the text, texting back, because that's how we communicate a lot of times in meetings now, as opposed to having to get up and go outside. We're able to do it by texting. But it is said that it is a tool like text4baby that provides an innovative way to connect with moms. And I encourage you to continue spreading the word to moms about the invaluable resource available to them, and it's all for free. It is easy, as Susan shared with you earlier, a woman can do this right from her home. And that's what just makes it so much better. And show them to, the text word is baby 511 411. If we can remember that name, baby 511 411. So simple and so easy. It connects with the other things we do in terms of 911, 211, so forth and so on. So if you can remember those numbers, you should always remember 415, 411, 511, and make a big difference in our message here. Now, I want to tell you that I appreciate the presence here, and I do appreciate being a part of this. Please know that I, as mayor of the city and city government, will help any way we can to be a part of this program and getting the message out to those who need to hear the message and being made an assistant to helping out. And the last thing I'll have to do is I'm going to call up someone who is, in my opinion, just like I call him McDaniels. That's what her name was in school, McDaniels. But this young lady, I'll let her tell the rest of that, because every time I embarrass her by saying one word to her about my involvement with her years ago, so I'm going to let her tell that story, because a few times I said it. I heard her whisper it to a friend, though, and she did that. I'll let her tell it. Nevertheless, this is, in my opinion, one of the most intelligent and beautiful women that exists, as far as I'm concerned. That's a fact. She has done more to improve this black belt area than any one person I know of in recent times. There's no question about that. I'm excited about the future that she has in politics. I believe that there's no doubt in my mind that she'll probably, if she chooses to be, the next state senator. I believe that with all my heart. She has that ability and knowledge. I believe that. She possessed a skill and a commitment that just makes her different from anyone else I've met. And that person is someone who used to, I saw in school years ago, and who also worked with my children as we all grew up together, as they all grew up together. But that is no other than Congresswoman Ms. Terry Sue.
I used to work with his children. I was his children's babysitter many, many years ago. I want to thank you, Mayor Evans, for not only having a great part in my life and my development, but in all that you do for our great city of Selma. As many of you know, this is my hometown, so welcome to Selma. I get the great privilege of representing almost all of the Black Belt counties, but there's no place like home. And I always fondly say that Mayor Evans is my mayor, since I'm originally from Selma. This is a great afternoon, so I want to welcome all of you here and thank you so much for being a part of this commemoration, which is really a celebration of National Infant Mortality Awareness Month. It is truly a pleasure for me to be associated with such an innovative program such as text4baby. I think it's awesome that we are meeting mothers where they are. Communication these days is mostly through wireless, texting, emails, and I think it's awesome that the Wireless Foundation, I want to thank Kimberly Bassett and the Wireless Foundation for providing this free service. I also want to thank Susan from Johnson & Johnson for being a founding partner and working so hard. Obviously, Janice and all of you from the Alabama Department of Public Health for your involvement as well. And all of you moms, expectant moms, grandmoms, ladies in our community, I think it's critically important that we start spreading the word of how we can better have wellness for not only the baby, but also for moms. You know, we are blessed in this nation to have a First Lady that has really gone out of her way to promote good nutrition and health and wellness. And I think that it's critically important that we do the same. You know, while the infant mortality rate, I'm glad to see, is going down here in the state of Alabama, we in the Black Belt have a particularly harder time with that. And I think that a lot of that has to do with lack of information. So I am so pleased to see so many of you sitting here in the audience today who will take this information, hopefully back not only to your own immediate families, but to your church family, to your extended family. The information that you will learn today is invaluable, I think, in promoting wellness and having healthy babies and healthy moms. You know, education, I always say, is not only the great equalizer in America. I mean, only through education could a little black girl from Selma, Alabama, have had the life experiences that I've had. As many of you know, I went to law school with the President of the United States. And that could never have happened if it weren't for the power of education. And education begins day one when you find out that you're pregnant. It begins day one, what we feed our children in utero, how we make sure that we make ourselves healthy so we can produce healthy children. It starts day one when you find out that you're pregnant. And I think that Text for Babies is a wonderful way to make sure that we meet people where they are. And we get our information not just from the television, not just from word of mouth. We get our information from our wireless communication, and being able to receive a text, as I understand it, from Chantel. I want to thank Chantel. Wasn't she awesome? So courageous to get up and talk about her experience with Text for Baby. And so I want to thank her, but I want to thank all of you, because I think it's awesome that you can, as I understand it, you hear week to week, you'll get text messages about what's going on in your tummy, and what's going on with the baby, what you should be doing. So it's a great way to stay informed and also to get information. I think that if we can each one teach one, we would be a much stronger and better society. I know that I have the great privilege of representing 12 counties in the 7th Congressional District, but I want you to know that my passion has always been in the Black Belt and rural parts of my district, having been a product of rural America. I think it is critically important that we try to help each other and help ourselves. Personal responsibility, I think, is where it's at, and we can only take personal responsibility for our lives when we are informed, when we are healthy, when we are well. And so I just want to, again, thank all of the partners here today, and thank the City of Selma for hosting us today, and really want to thank J&J and Wireless Foundation for your partnership. And I am so proud of Alabama Department of Public Health for all that you do in making sure that we stay well and healthy. So let's enjoy the rest of the day. I know that we'll learn a lot of wonderful information, but again, I am just privileged, my office is privileged to be a part of this initiative, and making sure that we spread the word that we in West Alabama are getting informed, are getting involved, are really taking a stake in our own lives and our own development, and it begins with each of us. So thank you so much for allowing me to be here today and to be a part of this program.
Thank you very much, Congressman Sewell. So now we are pretty much wrapping up the first part of our program today, but we have a raffle that the Congressman's going to help us with. We have several gifts for the moms who are here in attendance. So ladies, if you will please pull out the green stuff that you were handed, look for the last numbers, and the Congressman's going to pick a winner. I hope you are the winner.
Okay, so I just give out the last few numbers. All right, so I just chose 902-865. 865. Do we have a winner? Yay! It's a dad. We love that. I think that is awesome to have our males and our fathers also getting active. Text for Babies, not just for the mommies, for the whole family. So this is awesome.
Here you go. Great. Thank you. You want to come down and get your gift? I'll come to you. Awesome. Congratulations.
Thank you very much, Congressman. Well, thank you all for being here. I want to thank Susan Camp, Jensen Johnson, Kim Bassett, Mayor Evans, Mr. Holliday, and of course, all of the partners who've made this event a success. We're now going to continue to the next phase of the program. So now I would like to welcome the moms who are finished with their meals. If you wanted to come up here to the chairs and move a little bit closer, we're going to have Ms. Denise Pope give you a little bit of a cooking demonstration. So I'm going to pass the mic on to her, and I welcome the speakers to mingle with their partners, get some lunch, take a little girl, little boy break, and we'll get this going. So ladies, don't be shy. I do not bite. I'm very sweet. Please come up here, and gentlemen as well. If you're still eating, you can stay back there. Do you prefer to stay back there? None of you are responding to my pleas to come up front. Please come up. Please, I beg you. You're finished with your meals. Come up. Denise is a wonderful person. She will not bite either. So Denise is also going to give you little recipes, I believe, of the meals that she's preparing today. Now, one of the really cool, exciting things about what Denise is bringing to the table today is that these are items that you can buy if you are in WIC. These are items that you can actually go to Walmart or the Winn-Dixie and buy the items that you need. So she's going to give you everything from a burrito, a dessert, and then there's one more piece. It was delicious. I was tempted not to eat it earlier, so I'm preparing it. So, Denise.
Yeah. Can y'all hear me okay?
In the bag, they might not.
Okay. Y'all gonna have to listen up because I don't know if I can do a cooking demonstration and hold a microphone at the same time. I'm Denise Pope, and I am a registered dietitian. I work for the Alabama Department of Public Health, and I work for the WIC program. And I'm so excited that Congresswoman Sewell was here today because she's going to support the WIC program on the Hill front. So, and I'm not supposed to campaign at work, but anyway, I couldn't help that. I'm excited today to have Rebecca Stewart here with us. Rebecca's a dietitian at the Dallas County Health Department, and Rebecca's in the back. And y'all probably, if you've been to the health department, to the WIC program, you've seen Rebecca. She has a twin sister, Rachel, so you can't tell them apart. I can't either, so it's okay. Also, we have two students from the University of Alabama studying nutrition that are here with us. Bentley, I can remember her name because the governor's name is Bentley, and Susanna. And I'm not going to try to tell you their last names, but this is their last week of working with the health department, so we're excited that they can be here today.
Thank you so much.
How many of you are on WIC, and it doesn't matter, but I want to tell you just a little bit about the WIC program. WIC is a nutrition program for pregnant women, infants, and children up to the age of 5. It is income-based, but if you're on Medicaid or food stamps, you automatically meet income requirements for WIC, and we don't assess any additional income. But there's also pretty generous income limits for working families as well. And you receive nutritious foods and nutrition education.